Okay, it is Tuesday at 5:30, favorite time of the week. This is our Woodlands live Q&A. So this week we got a couple questions coming in. At the top of the list, we've got scar healing. Can you explain normal scar healing? I'm scared of getting the lollipop scar after a breast lift. Nobody wants a scar anywhere on their body. Nobody wants a scar in a cosmetically sensitive area like the face or the breast or anywhere else. And it's in that category of a trade-off. We may not like the shape of our breast or the position of our breast. And unfortunately, the only way to improve that, to do a lift, to do an augmentation, to do some sort of cosmetic operation is unfortunately with an incision at this point in time. There have been, improvements in non-surgical treatments. There have been improvements in minimally invasive techniques and things like that. But unfortunately, at the end of the day, there is no way to get rid of the extra skin that occurs with breasts that have aged or gotten large and droopy, lower abdominal skin after babies and weight gain or weight loss. If there's extra skin, unfortunately, even in 2021, the only way to remove it is to excise it and surgically remove it. And when we do that operation on the belly, we call it a tummy tuck. When we do that operation on the face, we call it a facelift. When we do it on the breast, we call it a breast lift. And so there's no non-surgical technique, no cream, no lotion, no potion, there's nothing that's going to get rid of that degree of skin. Similarly, although there have been major advancements in the non-surgical realm, radio frequency technologies, ultrasound technologies, what else is there? Anything you can think of, tripolar technology. None of it, they have modest skin tightening at best. Not saying they don't work, but it's all a question of degree, and it's all a question of using the right tool for the job and also setting realistic expectations. So these technologies absolutely do work as long as you define what your goal is and you set realistic expectations. If somebody comes in and they need a tummy tuck, no amount of cool sculpting or tripolar or radio frequency or cool sculpting is going to get rid of that extra skin. It might melt the fat, it might tighten the skin a little bit, but that skin is still going to be there. Same thing with a breast lift. No non-surgical technology is going to take a breast that's down to here and bring it up to here without a scar. We're just not there yet. Maybe one day we'll get there, but we're definitely not there. And so we call it a trade-off, and we say, hey, we don't want the scar, but we accept it, and it's a trade-off. And at the end of the day, would I rather have my current breast shape, size, position, etc., or would I rather have the shape, position, size that I want, but I've got to accept these scars as a trade-off for it? And that answer is different for everyone. I've had patients come in where, respectfully, I thought there was major room for improvement. I would be surprised if I showed the photograph to people that, if we put it to a vote, I think clearly the majority would agree improvements could be made. But for her, we just lost the power. Sorry about that. Rule number 1 in television, never mention what's going on in the studio around you. Anyway, so with breast lifts, so I mean, again, I think if we put it to a vote, most people would agree she could benefit from a lift, but for her, she was okay with the shape of her breast. She kind of wanted a little bit of a lift, but once I said the scar was involved, she's like, hey, I'm out. I'd rather be the way I am than have that scar. And that's a personal choice. Nothing wrong with that, right? And so, when we talk about scars, we do have to talk about the phases of healing, because anybody can take a picture of any scar at any stage of healing and demonstrate an amazing scar or a terrible scar. And the reality is that most scars go through phases. The majority of scars heal in an acceptable fashion, meaning when you look at that trade-off relationship of, wow, I did a breast lift with an augmentation, my breasts look so much better than they did before, I'm totally okay with the scars I have. And I would say that happens 98 times out of 100. I mean, the number of scar revisions for breast augmentation or lift is I think I've done 2. It just doesn't come up. The breast tends to heal quite well, and people tend to be happy with it enough that it's just not worth touching up or doing a revision. And I mean, part of that, low revision rate might also be because I do spend a lot of time discussing expectations and setting realistic expectations for scars. During every consultation for every single surgical problem, I always open my own gallery. Go to thewoodlandsplasticsurgery.co, not to be confused with .com, and load up the gallery. Go through photos. I try to find people that look like them, and then I also just try to find representative scar examples. I don't try to show just the absolute best, because that sets an unrealistic expectation. I obviously don't want to show the absolute worst. I want to show a realistic expectation of what can be achieved with, the operation that we're discussing. And on the breast specifically, the different areas and the different types of scar patterns heal slightly differently from each other. With a breast lift, they range in scar pattern from being just around the areola, what we call a circumareolar lift or mastopexy. So it's just a scar located around the areola, at the border of the areola and the normal skin. The next step up from that, if we need more of a lift, so that circumareolar is a very mild lift. It's something who just has a little bit of droopiness. The next step up for somebody with a little bit more droopiness is to do what's called a circumvertical lift, or some people call it a lollipop lift, which I think is an apt name because it has that incision around the areola and then vertically down from the bottom of the areola down to the bottom of the breast. And then the third step in that process, when you need a full lift, and that circumareolar or lollipop lift won't lead to a satisfying result, we have to do what's called a wise pattern lift. Some people call it an anchor pattern lift. Some people call it a keyhole pattern lift. So basically imagine that lollipop, so around the areola, vertically down to the base of the breast, and then there's one horizontally underneath the breast, in that natural fold under the breast. It's called the inframammary fold. And it's basically where your breast tissue meets the chest wall, and so we hide that bottom horizontal scar in there. Those three different areas heal very differently. Typically, the areolar scar tends to heal the absolute best and tends to heal the finest, the narrowest, the most pale, and tends to blend in the best. And let's also define what a good scar is. Doesn't matter what anatomy you have, it doesn't matter what skin type you have, it doesn't matter what pigmentation you have, it doesn't matter if you're a tan person, a pale person, a dark complected person, a light complected person. A perfect scar is razor thin, pale white, and flat. When any one of those three characteristics starts to get compromised, we start saying that it's a suboptimal scar or a bad scar. You can have a pale scar that's flat, but it's really wide. You can have a razor thin scar that's flat, but it's pink or dark or pigmented, and that can also lead to dissatisfying results. And so one of those three things falls off. With the areolar scar, we tend to get the best of all those worlds, where it tends to heal just like that. Pale, pretty well razor thin, might widen to maybe 1.5 millimeters, 2 millimeters, something like that, and flat. The vertical scar tends to heal the second best. That tends to widen a little bit, but we still usually get a pale white and a flat scar. But it does widen a little bit. What's a little bit? Probably 3 millimeters. That's pretty average, I'd say, about 3 millimeters. That's about the length of a pencil lead that's sharp. And then the horizontal scar tends to have the least ideal scarring. That one does tend to widen more. It usually does heal pale white. You can get some pigmentation issues in that area. You do get some widening where it's more like 4 or 5 millimeters, 1/4 inch, something like that. And sometimes you can get some thickening of it towards the ends of the incisions. And so that scar tends to demonstrate different levels of ideal healing, even in the same scar. Somebody might look perfectly over 45% of it, 55% of it, and then 10-20% might look so-so, and then 5% might be, kind of objectionable. Hey, let's do something about that. And so different areas heal in different ways. And the other important thing to keep in mind is that scar healing goes through phases. Scars look their best the minute they're closed because the body hasn't actually started healing yet, so it just looks like an invisible line, basically. And then they take a step backwards, they take a step down where they look their most objectionable, actually the first really 2 to kind of 6 months of surgery, where they'll be pink, they'll be thick, they might be elevated, they'll be pretty noticeable, especially on a fair-skinned patient. That pink really does kind of glow against a white background or a fairly complected patient. Then they start to look their best as you get the 6 months to a year. And so it's that 3 to 6 months where people can be a little frustrated, where the scars maybe don't look quite so ideal. But when all is said and done, when you get to that final 1 year, the scar has matured. And at that point, we say, hey, this is the new normal. Are we happy with it? We're happy with 95% of it. Okay, do we want to touch up that last 5% and see if we can kind of get it back in line, so to speak? Or do we leave it be? And like I said, in my practice, you know, revising scars is pretty uncommon, but if it needs to happen, we do it and we just touch it up and be done with it. So hopefully that clarifies some of that. It's kind of a big topic. Pictures help. I don't have any with me right now, so I apologize for that. But it's another good way to also look at results on websites. Generally speaking, just because of the nature of cosmetic follow-up, almost everyone shows up for their first, 3-month follow-up. After that, how often people follow up is very hit or miss. And so a lot of the results that you'll see on many plastic surgery sites, mine included, are skewed towards slightly more immature scars. And so just kind of be aware of that when you're looking at results. And I, of course, cover that with all my patients when we're looking at the photographs together and figuring out what we need to do to get from point A to point B. So what else? So next on the list, so they want to know if I have any new sculptures that I'm working on. Well, that's a fun question. So if you don't know, I do some sculpting. It's kind of a side hobby of mine. It's actually a very late development. I've done plenty of artwork before. Since high school, I was into drawing and painting and stuff like that. And I had a knack for it, but never really pursued it aggressively. And then randomly, actually my wife kind of inspired it, because when she got pregnant, I just got it in my head that I wanted to make a marble sculpture of her pregnant with our first kid. And it stuck. And of course she hated it, because she's like every other pregnant woman who, doesn't like the way she looks. She's super self-conscious. And she of course hated the idea. Suffice to say, there's still not a marble sculpture of my wife pregnant at this point in time. But nonetheless, I still got that bug to try and explore sculpture. And so I do that now as kind of a side hobby. There's a couple pieces in the office that I've done. There's a torso, a female torso. There's a hand, and then there's a kind of a trio of hands of my hand with my two little kids. In terms of new sculptures, I do have a couple projects in mind. I haven't started them yet. One of the idiosyncrasies of sculpting in clay is that there is a clock. And if you don't finish your project in time, the clay basically turns hard as a rock. You can't work with it anymore. And so I've had a couple projects that I started. I didn't have adequate time to see them through to completion. So you get really frustrated because you put in a fair amount of effort, start getting things looking decently, and then the clay dries out to the point where you can't really do anything with it anymore and the project is lost. And so you have to be strategic in terms of when you take on these new projects, make sure you can actually see them through to completion. But there's at least 2 projects, 3 maybe, that I'm heavily inspired to do. I don't know which one I'm going to do first. Suffice it to say, they're going to be kind of themed with kind of my practice and what I do, which is basically going to be related to the female form, changes that they go through with pregnancy, with breast surgery, with breast cancer, and kind of personal journeys, childbearing. And so, different variations on a theme and kind of different things I want to explore, and things that I haven't really seen before, because most people don't really think to sculpt that. So I'm hoping to get them done at some point. Like I said, I just need to kind of mentally prepare and get my schedule set up so that I can actually sit down and make sure I'm able to see it through to completion, because suffice it to say, it is quite frustrating to get a project 80% done and then get busy or go on vacation and come back and the clay is just, rocks in your hand that crumbles when you try to shape it. So let's see, we are at 5:45. We have one more question about the difference between a mini tummy tuck and a full tummy tuck. I'll touch on it briefly, and maybe I'll pick up next time with that, depending on how many questions we have, and I'll kind of make a note of that down here. The short version, sorry, connection blipped out. So the basic difference between a mini tummy tuck and a full tummy tuck is an incision around the belly button. So you don't need an incision around the belly button with a mini tummy tuck. You do need an incision around the belly button for a full tummy tuck. The second big difference is how much skin is removed. And that's really how you determine if you're going to get one or the other. Because if you don't have enough skin to remove to do a full tummy tuck, or things are too tight, then you have to convert to a mini. Put the other way, if you have a ton of extra skin, you really need a full tummy tuck to get the results you want. And so some patients come in thinking, oh, I just want a mini tummy tuck. And it's like, well, you really kind of need a full one to get the best result. So it's, you know, it's one of those terms that can be misleading for patients because naturally everybody wants the mini surgery, but it just depends on what you're a candidate for. And there's a whole deeper rabbit hole we can go through talking about what is the difference, what are the techniques we can do, how do we blend the two. We can do an extended mini tummy tuck. There are powerful techniques we can do, and maybe we'll table that for now, save it for next time, and next Tuesday we'll kind of pick up where we left off there. So hope you guys are having a wonderful Tuesday. This is pre-hump day. I think we should just call it hump day. I think the week is kind of like skewed to the front and then it gets easier as it goes. So I think Wednesday's like more the post-hump day. I think Tuesday is like peak of the hump, you know? Monday, you're still just kind of like, how do we get to Monday? Wednesday, you're like, okay, at least Tuesday's behind me. Anyway, hope you guys have a good night. We will see you next time. Keep the questions coming. This has been a lot of fun. Hopefully it's fun for you guys. And see you next time. Over and out.